If you're a migraine sufferer, then you know how unbearable life can sometimes be. Migraine and headache disorders can sometimes be devastating for a person, not only physically, but emotionally as well. This morning, we're going to talk more about what causes migraines and what treatments are out there today and how you can improve your quality of life. Joining me this morning to discuss this important topic is Dr. Ralph Menard, board-certified anesthesiologist with a subspecialty in pain medicine, Greg Lewis, the director of Advanced Migraine Relief, and Jenny Bruner, who has suffered from chronic migraine for 7 years. Good morning to all of you.
Good morning.
Good morning.
Thank you so much for being here. Before we get started, I have a few statistics I'd like to share with you. And doctor, I'd like you to chime in on these if you may. More than 37 million people suffer from migraines.
Well, that's 10% of the population of the United States alone, not counting the world. That's just the United States. And as you may have mentioned, 75% of those are women.
Which leads me to number 2. Listen to this. 3 out of 4 migraine sufferers are women, usually between the ages of 20 and 45. Women who suffer from migraines also tend to report migraines that are much more painful and with worse symptoms, including nausea and vomiting. That's alarming.
It is, because those kind of things, they disrupt your day. You can't work if you're nauseated and vomiting, spending all your time in the toilet.
It's true.
Yeah.
And you can't even function. And Jenny, I know that is something that you've lived through. Tell me your personal story.
It started in 2007, and one day, for whatever reason, I woke up with a migraine and it just never went away. So we had to figure out what was going on, and after using multiple medications and trying acupuncture and injections and whatnot, we finally found, in massages, yes, we finally found the neurostimulator.
And thank goodness, because my best friend suffers from migraines, and she'll tell, and I can't relate. She'll tell me, Olga, it paralyzes me. How did it affect your life?
I had to go down on my hours at work, which was very, very hard, because being a teacher, I love that. And so it was very hard to say goodbye to some of my classes. And then I had to move back home because I was unable to pay my bills because I wasn't able to work. And it was very hard being a young, in your late 20s type of person and having to go back and rely on mom and dad.
And doctor, I know you can relate because you suffer from migraines.
Oh, I did, yes. 13 years old was the first migraine. And then recently, I went home, had one of those bad migraines where you can't think. And so I was trying to push in the alarm code buttons. I got the numbers right, but I couldn't get the order right. And finally, they had to call me up and ask me what my password was.
You couldn't even do that?
No.
And Greg, let me read this statistic, and I'd like you to chime in on this. According to the Migraine Research Foundation, American employers have lost more than $13 billion, with a B, dollars, resulting from 113 million lost work days due to migraines. What an impact.
Yeah, it's a huge impact, and to what Jenny said earlier, it affects your family life because you don't have the compensation or the income coming in from the jobs that you want to have, but you just can't function. You can't have the job due to the lights in the office or just the environment as itself. You can't function. You can't get the job done, and the employers, unfortunately, have to find somebody that can, and it's a big problem.
But we got great solutions for people out there, and Jenny, I know you have a great story, and things are much better for you. So when we come back, we're going to talk more about migraines, what causes them, the different kinds of migraines, treatments, and the help for those living with pain. So stay with us. The Balancing Act will be right back. Welcome back, everyone. We've been talking with Dr. Ralph Menard, Greg Lewis, the director of Advanced Migraine Relief, and Jenny Bruner, who has been living with migraines for 7 years. Doctor, tell me what causes migraines, or do we know?
I wish we did.
Okay.
I know it's part of activation of one of the major nerves in the head, but other than that, we really don't know exactly what happens.
And let's be honest, when one says migraine and another says headache, I know for a fact they're not the same.
No, they're not the same. A migraine is a type of headache, but they're not the same. They can be treated quite differently.
Exactly, and treatments for both, again, totally different.
For the most part, yes.
All right, so when it comes to treatments, Greg, what options are out there for people who say, okay, I have migraines, I've done everything, what can I do?
Yeah, there are a lot of options, and that's the process that most migraineurs, such as Jenny, go through. They start off with medical management. They find a neurologist that is treating the medication side to try to find something that will relieve the migraine. And a lot of patients will respond to this over time. It may change, but a lot of patients respond to
Actually,
that.
most patients respond to medical therapy.
Okay.
There's chiropractic massage, there's acupuncture, there's biofeedback. There's all different types that you look to a holistic approach, all the way to surgical interventions. With Jenny, ended up in a surgical intervention with neurostimulation.
Because she's one of those unfortunate few that have failed everything. At the end, when they have failed everything, then what we do is we put a little tiny wire over, there's 4 nerves that control headaches. It doesn't matter whether you have a migraine or what, but 4 nerves control headaches. And if we can stimulate those 4 nerves, we can control the headache.
I see.
So we put a little wire over the nerves on the forehead, one over each eye, and one over each side in the back of the head, and hook it up to a battery that's about the size of a pacemaker. In fact, it is a pacemaker, just a different program. And all of a sudden, they have their life back again.
And I know for a fact you've witnessed amazing stories of people just bursting out in tears.
Well, not the patient, which is the funny thing. Recently, I had a family in the waiting room. We turned the stimulator on. Her headache went away. The husband started crying.
Oh, my goodness.
It brings tears to my eyes.
No, that's amazing.
Yes.
Okay, and when you failed everything, Jenny, and you sought this treatment, tell me how it changed you.
It was amazing to finally have something that worked, and it totally changed my life. There were no words, actually.
And Greg, what a difference it makes for someone that really, like my best friend Jenny, you know, she's living with her mom and dad, she can't become the teacher she wants to be, and shazam, now she's got her life back. It's just got to be so rewarding.
It is, especially knowing Jenny and her family, you see it and you want to continue this with other patients as best you can. Again, it's a process. It's what Jenny ended up with neurostimulation isn't for everybody. And the goal, honestly, is to stop somewhere before that. It's nice to know that it's available, though. There's different surgical interventions, neurostimulation being one of them, that gets the control. It's not a cure, it's a control mechanism.
Doctor?
Correct. We're not curing the problem. What we do is give their life back because now they have control of their headaches.
And if anybody wants information on migraines or treatment options, Greg, where would they go?
ControlMyMigraine.com. It's a page that you can go to. You can set up a one-on-one appointment, and what we do is we get you in the process and work with you to understand where you're at. That's the starting point. Is not trying to get to where Jenny is today, but to find out where you're at. It's a process that Advanced Migraine will work with you on.
And I like that. You find out where they have been, where they're at, and where they can go.
You have to.
And I want to end with you, Jenny, for anyone out there that may think, okay, really? Like I've had them for X amount of years. What would you say?
I would say go to the website and
get your life back?
Exactly.
And
yes.
you did.
And because you can.
Teaching full time, I'm assuming.
Teaching full time, I got married, and everything is wonderful now.
You're not living with mom and dad anymore.
Well, more important, she's teaching little kids.
2-year-olds, yes.
2-year-olds.
The ones that give you.
Exactly.
Thank you so much. I remember the terrible twos. God bless all of you, and Jenny, I'm so glad you got your life back. Thank you. And if you'd like more information on this important medical issue, please visit us at thebalancingact.com. That's thebalancingact.com. Or share with us your thoughts on Facebook /The Balancing Act Fans.